Good morning and welcome to some Facebook Live with the Integrated Wellness Clinic. My name's Courtney.
And I'm Kate.
Hi, so we're going to talk today a little bit about who we are, what we do, and our topic of the discussion today will be eczema, particularly in children, treatment options, testing options, and where you can find further information. So, Integrated Wellness Clinic, if you've just joined us for the first time today, hello and welcome. We are an integrated wellness clinic that works predominantly with naturopathy, but we also have nutritionists, psychologists, and soon to be some other practitioners that all work holistically with yourself, your health, your concerns, and ultimately, I suppose, a naturopath at the heart of it. We focus on the individual, firstly, and we look at the underlying factors. So you might have a symptom, and you may have been focusing on that symptom, you may have already received treatment for that symptom, but here as naturopaths, what we have passion about is resolving a symptom by looking underneath, looking at a person and all their intricacies and individualities, and working out the best treatment to correct anything that's underlying and really triggering and creating that particular symptom that's become an issue or condition if that's something that you've been diagnosed with. So we are going to, what are we going to talk about today, Kate?
Today we're talking about eczema, especially in children.
Yes.
Which is quite common. We see a few kids coming through the clinic these days with eczema, and we have lots of different remedies and things that we can do, but like Courtney said, we like to get to the underlying cause. What is causing this eczema to start with?
Yeah, beautiful. So let's give a quick overview on eczema. Let's start at the basics. So eczema looks irritable, red, inflamed, often dry, sometimes scaly, can be a little bit raised. Itchy. I mean, what it likes to sort of congregate in creases, would you say?
Definitely, where it's a bit warm or can get sweaty in the kids as well.
Yeah, so crotches, crooks of elbows,
back of the arms too as well.
Yeah. We've got a lot of mothers and patients that come in, they've usually tried something and often that doesn't work. If we look at, say, for example, the history of an individual, let's just say a 2-year-old, and this 2-year-old has had on and off eczema and it hasn't really gotten any better. In fact, it gets worse. Some of the things we'll start to look at, firstly, is the health of the parents, because there's an understanding that genetically speaking, there could be a higher percentage of children who were born to parents who had eczema as a child or had what's called any number of the atopic triangle. So an atopic triangle includes asthma, eczema, and allergies. So those 3 things are often really seen, sometimes in combination, not always. So we might look at the parents. We might look at the particular child's sort of life journey so far. So what are some of the things we might ask a child if they've come in with eczema, like of their time with us so far?
Sure. So when the kids present with the eczema, we're sort of looking at what's been happening. So if they're 2, what's happened in their first 2 years of their life? What was the birth like? Was the baby breastfed?
Mm-hmm.
Has the child ever had any antibiotics?
Yeah.
And like you were saying, the history as well, from the family history as well,
Perfect.
to see if there's any eczema in the family. If the child has any other symptoms, like Courtney said, asthma, hay fever, allergies and things like that. So we really need to get a broad picture of what's been going on in the child's life.
Perfect.
Is that what you would say?
So what we're going to do then, we're going to get a bit of an understanding of the history of that person and that little child, and we're going to start to look at if any of the factors Kate's mentioned are present. We're going to want to investigate that a little more. So let's start with, say, the health or even the exposure to, say, something like antibiotics, either during the birth journey or once they've been here. That in of itself can change the gut health. And if you know anything about gut health, we're always looking at the microbiome, the levels of good and bad bacteria. So as a naturopath, if I'm looking at a symptom of eczema, I may actually need to go all the way down to the health of the microbiome and start there. Yeah. We might need to be looking at triggers. Environmental can be one, but also dietary. So is it worse when the child eats XYZ foods? Is it worse in summer or winter? And then work with the patient and the parent to make sure that we can not only identify these triggers, but start to create an environment and lifestyle where they can be reduced to not only stop the symptom picture, but also so we can give the body a chance to heal and actually repair itself. Treatment options in the naturopathy world some of the things we're most passionate about are herbs. Delicious, amazing, fantastic tasting herbs that just taste just like rainbows and lollipops. That was a joke there. They can be quite bitter, but they're super effective at what they do. So treating and rebalancing someone's gut, supporting and strengthening someone's immune system, filling a deficiency if they become deficient over time in their zinc or their nutrients that help the body to repair itself. And we also can do topical things. So if you've had some experience with the cortisone cream and it's not what you like, or you're really trying to move away from that kind of approach, we have the herbs that we use internally. We can actually make up creams and use externally, which
work wonders.
I think some of the patients and parents that I've worked with are most excited about that, because not only do they now using something natural outside of the skin, it gives relief, and they don't have to be worried about using it at a minimum time frame, which cortisone creams need to be really only used very short term.
Yeah. So we do have some internal herbs and things like that we can take internally and also externally, which is really good for kids. Because if we can do some external creams, it can give them that instant relief, hopefully, whilst we're building up their immune system and looking at gut health and stuff like that.
Absolutely. So I touched on testing. With naturopathy and how we view the body, we're so passionate about getting the answers, and that's how we get targeted treatment. So we ask the body questions in the way of testing. So I might want to test an individual's gut health by using stool testing. I may want to test an individual's nutrient levels, and that may take a blood test. Sometimes we can do hair testing, less invasive if they're particularly little. Yes. We can also essentially look at food testing if we do feel foods really are a trigger through the diet. So the testing provides us with the answers to give the direct and targeted individual treatment that makes recovery and repair and resolve a lot smoother.
Absolutely.
There's some really fun and informative workshops that are happening in our community through Integrated Wellness Clinic. There'll be actually a workshop on food testing and food allergies and sensitivity. So these, as I said, they may go hand in hand, they may not. If you've got questions and this little chat's kind of bringing up some things for you or a loved one, I highly recommend jumping on our Facebook page and checking out when we're running those through the community. I believe Caloundra and Mooloolaba have some dates.
Yes, in August. Yep.
Yeah. All we want to do is educate and impart as much knowledge as we can that we have at our fingertips to you and our community, so that we really are empowering you to be able to know what to do with your health and get the changes and the fixes and the resolves that you're after. Is there anything else we want to add on this?
Probably not. Like I think we covered everything, and like you said with the testing as well, it really will be able to get to the underlying cause, and that's also really important when you come with children with eczema. The body's showing a sign that something internally is not right, the immune system's off or the gut's off. So with the testing we can really look into it, and as Courtney said, there is food testing, so we can actually test if there's an allergy or a sensitivity to things like egg or wheat or dairy or strawberries or fruit or any type of thing that might be setting off this immune inflammatory response. So
and some of the things that we do discover, particularly with foods, they can be innocuous everyday foods. Definitely. And when you get that knowledge of, wow, but he eats an egg every day for breakfast, and you remove that and you get incredible relief straight away, that can be really empowering. Because some people's journeys, I mean, we've sort of hypothesised a 2-year-old here, but we treat adults too, and some people's journeys with these conditions can be really chronic and long term, and never really feeling like they get on top of it. So empowering our patients to not only work out what it was that was causing it, but how they can fix it, and of course how they can stop it from happening again in the future and get that real long-term resolve.
Yeah.
Awesome.
Yeah, I think that's it for today.
I'm feeling pretty good about
very
that.
much for listening. Yeah, me too.
Thanks for tuning in.
Thanks, guys.
Check out our Facebook page for more information, and we'll see you again very soon. Have a good day.
Have a lovely day.
Thanks.
Bye.
Bye.